Thank you very much. Good morning, everyone. Hey, Jeff. Want to start out by just having another round of applause for the organizers and thank them for everything that they've done. It's not easy to do, especially given the type of job that they're in. I mean, you never know when a disaster is going to strike, and they can't be at a conference when that happens necessarily. So, hacking healthcare. Why did I choose this subject? Well, it touches everyone's life. And social media, the web, has a ton of promise with respect to improving health. Everyone here, no doubt, has had an encounter in the healthcare system. I venture to guess that most people here have children or aging parents or someone else who touches the health system. And our healthcare system is somewhat broken, and I think we all know that. Certainly from the finance side, but also from the provision of care, or the delivery of care, rather. So it's an area that's changing daily. There's a lot going on with the government, things that they're trying to do to improve the quality of care while at the same time lower costs. And the internet has proven over the past 10 years or so to have a significant impact on what happens in that realm. And social media itself has the potential to even offer more promise because it connects people. And in the realm of healthcare, that is something that historically has not happened as much. You'll find that when you encounter folks in the healthcare system, doctors, people often look at doctors as being the experts about their health, when in reality, people are the experts themselves about their own health. And so as the government, the United States government anyways, is trying to disrupt the current system to try to leave a path for innovation for all kinds of companies that are coming out with not just medical treatments, but also technologies that allow people to connect with one another online. Being able to leverage that and utilize that to improve health has certainly come to the forefront of what is happening today. So, healthcare is in a state of trouble globally, most certainly. We see it here in the United States, but throughout the rest of the developing world, we are in a situation where we have the population of aging people growing. That's generally referred to as people 65 and older. And though that population of patients are typically the population that are the most costly to care for, because we don't get to intervene in their health situations or their health early enough. Later on down the road, they wind up incurring relatively expensive healthcare treatments, and they comprise a great portion of the of what is utilized in the healthcare system. So we're predicting by about 2030 that 20% of the U.S. population or thereabouts will be over 65 years old, and that's up over twice to 3 times as much from about the year 2000 in those projections. So it's going to be something that's very important as far as the way that the healthcare system changes, utilizing social media and collaborative technologies to be able to reach out to those patients in their homes. And that's one of the big plans for making healthcare more affordable, is something called the patient-centered medical home, where patients are able to be treated and taken care of their conditions or their issues in their home, as opposed to incurring expensive costs or large costs in a medical institution. So the industry is looking to, or the government is looking to, collapse that model and actually put patients back into the home where they are able to be cared for by themselves, depending on their condition, but also their family members. So in doing so, you really need to have a strong communications channel between your health experts and folks in the home to make that really happen. And that's one place where social media really becomes extremely important in enabling that. Not just the web in general, email or the telephone system, but also telehealth, where we can create conversation between patients and their doctors without actually having to do an office encounter, where patients that are utilizing techniques or a movement called the quantified self to be able to monitor what their health stats are at all times. As a matter of fact, there was just an announcement this week on the heels of a Pew Center study on healthcare and the Internet Life Project that, let me refer to my notes, I'm sorry, where they basically said quantified self, and another site called Patients Like Me, which allows patients to collaborate with each other, are extremely important tools for allowing patients to collaborate with one another and learn from one another about their conditions, about treatments for their conditions. There's also a segment of the healthcare population known as e-patients. And that doesn't mean electronic patients necessarily. These are empowered patients. So these are people who are taking their own care into their own hands and doing whatever they can to get information, to share information with others. And that's really what social media is all about, is enabling that two-way conversation. So the effects that it has on improving health are tremendous. Another interesting story, a friend of mine, e-patient Dave, they call him Dave DeBronkart. He's in that population over 65, and about 4 or 5 years ago, he had some problems and visited his doctor. He was having some vision problems, some arm pain, and his doctor diagnosed him with a stage 3 or 4 cancer and gave him 24 weeks to live. Now, with a prognosis like that at his age, I mean, his chances were very, very low. But what he did is he went online and he started researching his condition and started engaging with communities of patients that had a very similar similar conditions. And the good news is that Dave is with us today. He has beaten his cancer. And one of the challenges that we face with social media and the internet and healthcare is that it's a very highly regulated system. So the things that your healthcare provider can tell you in person or in print are much different sometimes than what the real reality is on the ground. And that's why it's important for people with these experiences to be able to collaborate with one another and be able to get the real information. There's tons and tons of resources out there, tons of interesting information. If you have any interest in finding out more, I should be here all day. I'm Nate. You can come and find me, and thank you very much.